Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Budaya, and best wishes for all of us. Ladies and gentlemen, welcome to SGD B1's group presentation about problem-based learning in health services. Next slide. In today's occasion, we are joined by Arin Arnaz Widhanti, Matthew Refferty, Sienny Kuswardi, Krisnaditya Dwi Raharja, Ananda Aulia, Devaline Zarya Ramadhan, Putu Chintya Harum Rahcetag, Putu Yudistira Ananda, Gede Indra Prabawa Putra, Lishanda Bianca Kusuma, IG Mahapraja Divasta, and Rahel Juliana Manuro. Next slide.
Background: Review in Lumba in 1973 in Paswar 1996 defined health services are every effort that is carried out alone or jointly in an organization to maintain and improve health, prevent and cure disease, and restore the health of individuals, families, groups, and communities. There are two types of health services. The first is medical services. The main purpose is to cure disease and restore health. The target is to individuals or families. The second is public health services. Main purpose is to improve health and prevent disease. The target is society. As a result, medical students must not only learn the theory but also to put that knowledge into practice. Medical students are supposed to gain the knowledge, attitude, and perception necessary to develop solutions or alternatives in patient safety, which is a priority to be attained through this problem-based learning in health services. Next slide.
Problem formulations. So problem-based learning have problem formulations such as, what is problem-based learning in general? What are the challenges of implementing problem-based learning? How does problem-based learning differ from other learning systems? What are the advantages and disadvantages of problem-based learning? What correlation does problem-based learning have with health services? Next slide. From the problem formulations, we have objectives such as to better understand what problem-based learning is, to show what types of challenges are there from implementing problem-based learning, to demonstrate how problem-based learning differs from other learning systems, to illustrate the advantages and disadvantages of problem-based learning, to display the correlation between problem-based learning with health services. Next slide. From the objectives, we have benefits such as give sufficient information about problem-based learning and its distinction from other learning systems. Obtain plenty of insights into the correlation between problem-based learning with health services. Next slide.
What is problem-based learning? Next slide. Let's start with the definition. Problem-based learning is an educational method that uses problems found in daily life as the baseline for teaching and learning. PBL uses a student-centered approach using a small group to discuss the problems based on their own pieces of knowledge with the help of a lecturer as a tutor who motivates and facilitates them with guidelines to identify the problems. This would encourage self-directed learning ability where the students take the initiative to be responsible for their lessons with or without others. Moving on to the history of PBL. Problem-based learning was first introduced in 1969 at McMaster University Faculty of Health Sciences in Hamilton, Canada. The idea of this program was created by a team of doctors from Toronto Medical School led by founding Dean John Evans. Following the footsteps of McMaster University, in 1974, Maastricht University, Netherlands, also offered this method as a new approach to medical education. Maastricht University has initiated PBL training programs all around the world, which made a name for itself as a role model in problem-based medical education. Next slide.
The purposes of PBL. Problem-based learning has three main purposes: The first one is to help students self-identify their learning needs. In problem-based learning, we use student-centered approach that provides freedom for students to explore knowledge and make them responsible for their own learning. PBL also aims to improve students' ability to work in a small group. Students will work in a small group as known as small group discussion with a lecturer as a facilitator to achieve their learning objective. The tutor has a very important role in the students' experience in PBL. The last purpose of PBL is to promote students' practical skills on problem solving because in PBL, students confront with real problems that can help develop clinical reasoning as well as problem solving skill. Next, please.
The characteristic of PBL. Number 1, trouble as the starter. In PBL, problems are used to initiate learning. From this problem, then student will analyze what happened. Number 2, realistic. The problem that used in PBL is a problem that actually exists. Number 3, demanding multiple perspectives. In PBL, problem usually require students to have a variety of perspectives by looking for many possibilities that exist from the given problem. Number 4, challenging. Problems that are given in this learning will challenge students to learn new things. Number 5, prioritizing independent learning. This PBL prioritizes independent learning. Student independence in learning currently makes students active in finding or understanding concepts. Number 6, various sources of knowledge. To the tasks in PBL, various sources of knowledge, such as journal or other literature, will be needed. Number 7, the learning is collaborative, communicative, and cooperative. PBL allows students to be able to work together cooperatively and understand concepts collaboratively in discussion, then communicate them in front of many people. Next slide.
Next, we have mechanism of PBL. Problem-based learning has several kinds of mechanisms such as Branda's 12-step of PBL, Maastricht's 7-jump process, Harvard's 6-step methods, and PBL method by University of Sydney. The first one is Branda's 12 steps of PBL. The first one is to clarify and definition of the problem and then analysis of the problem, development of hypothesis and plausible explanation, identification and characterization of knowledge needed, identification of what already known, identification of appropriate learning resources, collection of new information or knowledge, and then synthesis of old and new information, repetition of all or some of the previous steps, identification of what was not learned, and then summary of what was learned, and the last one is application of the knowledge to the problems. The next one is the steps of Maastricht 7-jump process. The first one is to clarify, the second one is analyze, and then brainstorming and conclude the problem, formulate the learning objective, and then independent study and group share result. After that, these are the Harvard 6-step method. The first one is the written problem scenario are given to the group, and then the group will describe and analyze the problem. And then the study group identify the learning goals, and then the students study independently, and then they share the result and discuss them together. After that, the group synthesize and summarize their work. And the last one, we have the PBL method by the University of Sydney. This method consists of 3 steps. The first one is to generate. Here, students are expected to generate and expand hypotheses and identify the learning issues. The next one is to clarify. Students will gather all of the information needed, rehearsing the situation, also identify learning issues for deeper study, and then summarize in the end. The last step is to consolidate. Students are accustomed to explain signs, symptoms, investigation, and plan patient management. Next.
Okay, thank you. So there are several challenges that need to be faced when implementing PBL system. The first challenge is the complicated learning process. One issue needs a complicated and unfamiliar problem-solving process in PBL. PBL has step-by-step process, and each step is intimately connected to the other. The second challenge is self-directed learning. The student ought to set up the learning goal and strategies in knowledge construction activities. The next challenge is attitude of student maintaining confidence in solving problems. Students' low self-confidence can make them think a problem is difficult to give up before trying. This will result in learning objectives being not accomplished. Last but not least, every PBL tutor ought to have adequate training on problem-based learning. The challenge is that faced by the tutor range from handling group dynamic to ensure that the learning outcomes outlined are accomplished. Tutor must have a skill to motivate students and be able to foster a climate that is open, trustful, and supportive of learning. Next slide, please.
Okay, now we will talk about we can compare the PBL system with other learning system. The first one is traditional learning system, which is just focused on knowledge transmission without any self-reflection. The second is project-based learning, or PGBL, which is focused on determining the solution of the problem without any understanding about the problem. The third is team-based learning, where only one single facilitator in TBL can manage group of 20 students, where that 20 students can form a small group of 5 students. The last one is CBL, or case-based learning, which is a learning system that the student must do more preparation, like literature review, before the discussion. Also, the facilitator will explain the final answer and the conclusion at the end of the discussion. Next.
On these occasions, I will explain about the advantages of problem-based learning. First, in PBL, students are free to express and tell their ideas or arguments regarding the case questions. PBL also allows students to not only discuss the correct and incorrect answers, but also give a particular reason and theory from their own perspective so that it can improve their critical thinking skills. Second, through PBL, students are required to find solutions to the problems given and analyze the solutions obtained, which will expand their problem-solving skills. Third, students are given a case that has not been discussed before. From the topic they acquired through lectures, students need to reflect on their own learning to gather information and answer their curiosity that makes students learn how to learn. Fourth, through collaborative learning, students will build good teamwork through the process of transferring knowledge, exchanging information, and collaborative in solving the problems given by the lecturer. Also, every student will develop their communication skill with each other. Next, please.
So there are 3 points of disadvantage of problem-based learning. The first one is less adaptation. So a new kind of instructions is called problem-based learning. And as a teaching technique, it appears that developing curriculum and course materials, the PBL approach, takes more time. And additionally, the PBL method is not always understood by students. The majority of students are unaware of their own and their instructors' roles in the PBL process. And more than that, absence of mandatory faculty training on PBL facilitation. The second point is an absence of sufficient resources. So a high need to staff ratio, and tutors who play a crucial part in PBL by offering a comfortable learning environment, lack of proficiency in process and learning circumstances. The last point is rely on students' understanding. So, if students don't comprehend the issues that arose with social topic, they risk failing. Next slide, please.
Okay, so in this occasion, I will explain about health services in general. So public health quality is one of the crucial aspects of a country that must be taken into consideration. Good public health quality takes an important role in an effort to improve the quality of human resources, poverty alleviation, and promote economic growth. For this reason, the Human Development Index takes health as one of the important parameters along with education and income. A health services is defined as any unified, integrated, and sustainable activities or series of activities that aims to maintain and improve public health in the form of disease prevention, health promotion, disease treatment, and health restoration by the government or the public. So the quality healthcare can be defined in many ways, but there's a growing acknowledgement that quality health services should be. The first one is effective, which means that it must be providing evidence-based healthcare services to those who need them. And the second one is safe, which means that it must be avoiding harm people for whom the care is intended. And the last one is the people-centered, which means that it must be providing care that responds to individual preferences, needs, and values. And also, to realize the benefit of quality healthcare, health services must be The first one is timely, which means that it must be reducing waiting times and sometimes harmful delays. And the second one is equitable, which means that it must be providing care that does not vary in quality or on account of gender, ethnically, geographic location, and also socioeconomic status. The third one is the integrated, which means that it must be providing care that makes available the full range of health services throughout the life course. And the last we have efficient, which means that it must be maximizing the benefit of available resources and avoiding waste. Next page.
Thank you for the opportunity. One of the most important roles in health services is a doctor. How to graduate a good and capable doctor? Several research that has been conducted show that the use of the problem-based learning method is more efficient than attempting to apply learned formulas to clinical situations. As we all know, health problems often require more than one solution, which are usually very complex and may need to be broken down into several problems within a meta problem. Public health services usually involve working within groups with many stakeholders and needs people who are self-directed and highly motivated in their work. So, public health services require various skills that can be provided from problem-based learning, such as teamwork, self-directed learning, and problem solving. What is the correlation? Giving clinical problems triggers a positive effect and a significant increase in clinical skills, which is very useful and relevant for a doctor. And also, the New South Wales Public Health found that some evidence that PBL results in higher levels of motivation, greater application of knowledge in the workplace, better teamwork, and a more self-directed workforce. That's all from me. Thank you. Next slide.
So the conclusion of our discussion about PBL are problem-based learning is a learning method that uses problems found in daily life as the basic of learning to develop long life skills for solving reliable problem. There are also challenges in implementing PBL. There is a need to think creatively, understand complicated materials, and building confidence on students. Other systems that can be compared with PBL are TL, PGBL, CBL, and TBL. One of the advantage of PBL can expand the students' problem-solving skills, but the disadvantage is that the duration takes longer. Various skills of the PBL system can be implemented in health services such as teamwork, self-directed learning, and problem solving. Next slide, please.
For recommendations, due to time constraint in carrying out this research, the data collected was not comprehensive. Limited knowledge and limited resource restricted the results of this student project. Future research will expand the research to include more extensive topic about problem-based learning.
That's all from our presentation. We are sorry if we made any mistakes or said some things that are inappropriate. I hope that we all can gain many new knowledge about problem-based learning. Thank you for watching.